Hi, and thank you for participating in this brief webinar which summarizes OSHA's Respiratory Protection Regulation. I am Kevin Konkey, the Vice President of EHS Technical Services for Hygieneering, and I will present a high-level overview of OSHA's Respiratory Protection Regulation. Each main topic discussed in this webinar also corresponds directly to the compliance services that we can provide to our clients. Let's get started with written respiratory protection programs. OSHA requires employers to develop and implement a written respiratory protection program with required worksite-specific procedures and elements for required respirator use. The program must be administered by a suitably trained program administrator. Specific program elements are outlined in the regulation to include procedures for selecting respirators, medical evaluations, fit testing procedures for tight-fitting respirators, procedures for proper use of respirators in routine and reasonably foreseeable emergency situations, procedures and schedules for cleaning, disinfecting, storing, inspecting, repairing, discarding, and otherwise maintaining respirators, procedures to ensure adequate air quality, quantity, and flow of breathing air for atmosphere supplying respirators, training of employees in the respiratory hazards to which they are potentially exposed during routine and emergency situations, training of employees in the proper use of respirators, including putting on and removing them, and any limitations on their use and their maintenance. And lastly, procedures for regularly evaluating the effectiveness of the program. OSHA requires employers to evaluate respiratory hazards in the workplace, identify relevant workplace and user factors, and base respiratory selection on these factors. Occupational air monitoring assists in estimating employees' exposures to respiratory hazards. Occupational air monitoring results will help determine the level of respiratory protection needed if results indicate personal employee exposures at or above an occupational exposure limit, such as an OSHA permissible exposure limit. NIOSH certified respirators must be provided with sufficient respirator models and sizes to ensure proper user fit. Some respirator cartridges have an end-of-service life indicator to help a user determine when to change. In the absence of an end-of-service life indicator, a change schedule for canisters and cartridges must be developed based on objective information or data. You must describe in the respiratory program the information and data relied on and the basis for the canister and cartridge change schedule and the basis for reliance on the data. Employers must provide a medical evaluation to determine the employee's ability to use a respirator before the employee is fit tested or required to use the respirator in the workplace. Respirator medical evaluations must be administered by a physician or a licensed healthcare professional using a medical questionnaire or by an equivalent initial medical examination that obtains the same information as the medical questionnaire. Appendix C of the regulation contains OSHA's mandatory medical evaluation questionnaire. Respirator medical evaluations must be administered confidentially during normal working hours or when convenient to the employee. Depending on responses to the questionnaire or initial medical examination, a follow-up medical examination may be required. No matter how respirator medical evaluations are provided by the employer, they must offer an employee the opportunity to discuss the questionnaire and examination results with the physician or the licensed healthcare professional. Employers must obtain a written medical determination concerning the employee's ability to use a respirator. Additional medical examinations must be performed if an employer reports medical signs or symptoms, if requested by the physician, licensed healthcare professional, supervisor, or program administrator, when issues are identified during fit testing or a program evaluation, and lastly, if there are changes in workplace conditions. Employees must be qualitatively or quantitatively fit tested with the same make, model, style, and size of respirator that will be used before an employee may be required to use any respirator with a negative or positive pressure tight-fitting facepiece. OSHA's accepted qualitative and quantitative fit test methods can be found in Appendix A of the regulation. Qualitative fit testing uses a method of testing that utilizes the wearer's reaction to a substance to test the fit of a respirator mask. Qualitative methods can be performed by isoamyl acetate, saccharin solution aerosol, Beatrix, and irritant smoke. These methods should only be used for fit testing negative pressure air purifying respirators that must achieve a fit factor of 100 or less. Quantitative fit testing uses a method of testing that utilizes specialized equipment, such as a porta count, to measurably test the amount of leakage around the seal. Quantitative methods can be performed by ambient aerosol, controlled negative pressure, and generated aerosol. Employees using a tight-fitting facepiece respirator must be qualitatively or quantitatively fit tested prior to initial use whenever a different respirator is used and at least annually. Breathing air quality applies to atmosphere-supplying respirators such as supplied air and SCBAs. Compressed and liquid oxygen must meet United States pharmacopoeia requirements for medical or breathing, and compressed breathing air must meet at least the requirements of Grade E breathing air described in ANSI Compressed Gas Association Commodity Specification for Air G 7.1, 1989. The frequency of compressed air quality testing is not specified. It is recommended to test on a regular basis for liability reasons. OSHA requires employers to provide effective training to employees who are required to use respirators. Training and information should include why the respirator is necessary and how improper fit, usage, or maintenance can compromise the protective effect of the respirator, what the limitations and capabilities of the respirator are, how to use the respirator effectively in emergency situations, including situations in which the respirator malfunctions, how to inspect, put on and remove, use and check the seals of the respirator, what the procedures are for maintenance and storage of the respirator, how to recognize medical signs and symptoms that may limit or prevent the effective use of respirators, and the general requirements of the regulation. Training must be comprehensive, understandable, and reoccur annually, and more often if necessary, such as when there are changes in the workplace or the type of respirator rendering previous training obsolete. Inadequacies in the employee's knowledge or use of the respirator indicate that the employee has not retained the requisite understanding or skill, or when other situations arise in which retraining appears necessary to ensure safe respirator use. The regulation also requires basic information for voluntary use of respirators as outlined in Appendix D of the regulation. OSHA requires employers to evaluate the written respiratory protection program to ensure it is being properly implemented and regularly consult with employees to ensure that they are using respirators properly. Factors to assess include, but are not limited to, the following: effectiveness of the program, respirator fit, appropriate respiratory selection for the hazards to which the employee is exposed, proper respirator use under workplace conditions the employee encounters, and proper respirator maintenance. In summary, this was just meant to be a brief overview of OSHA's respiratory protection regulation. Hygieneering can assist with each of the main topics discussed in this webinar on an individual basis, or we can develop a customized service plan to support your environmental health and safety needs. We would welcome the opportunity to assist with your respiratory protection compliance needs or answer any questions you may have. If there's a specific need that might not have been mentioned in this webinar, reach out to us to discuss that need. This slide contains my direct contact information if you need to get in touch with me about your respiratory protection compliance needs or any other environmental health and safety needs. Thank you for tuning in to this brief webinar. Be sure to check out our website for future topics to get an idea of the environmental health and safety services we provide and how we might be able to assist with your environmental health and safety needs. Thanks again for watching.